How do past experiences influence current sexuality? What are the myths and realities of erectile dysfunction? Hello to all lovers of psychology and sexuality. Today, we will unveil the sexual curiosities of women. If you are interested in these topics, make sure to subscribe and activate the notification bell to not miss our future videos. Also, leave us comments and share your experiences in the section below. Let's get started. Past experiences can impact current sexuality. Positive experiences contribute to confidence, while negative ones can generate anxiety. Open communication and empathy are key to managing these impacts in intimate relationships. Common myths about erectile dysfunction include that it only affects older men or that it is purely a psychological issue. The reality is that it can affect men of all ages and have both physical and psychological causes. Treatment is possible. In the Netherlands, sex education focuses on prevention and contraception and is considered one of the most comprehensive programs in the world. Despite openness on this topic, the Netherlands has one of the lowest teenage pregnancy rates in Europe. Open communication. Open and honest communication with a partner is crucial for discovering and satisfying each woman's sexual preferences. Discussing what is enjoyed and what is not, as well as trying new positions together, can strengthen the connection and intimacy in the relationship. Personalization and adaptation. What works as foreplay can vary significantly from one woman to another, so it's important to adapt to the individual preferences and desires of each couple to create a truly enjoyable and satisfying sexual experience. Physical exercise and erectile function. Regular physical activity and aerobic exercise can improve erectile function by enhancing cardiovascular health and increasing blood flow throughout the body, including the penis. Pornography and addiction. There is debate within the scientific community about whether pornography can be addictive, with some studies suggesting that certain individuals may develop a pattern of compulsive consumption similar to other addictions. Power role fantasies. Some people enjoy sexual fantasies involving power roles, such as boss-employee, teacher-student, or doctor-patient. These fantasies can provide a safe way to explore consensual power exchange in a controlled environment. Prevention methods. Consistent and correct use of condoms during sexual intercourse remains one of the most effective ways to prevent the transmission of STDs. Psychology behind fetishes. Psychologists and sex therapists study fetishes to better understand their impact on people's sexual lives and how they can affect interpersonal relationships. Most fetishes are believed to be harmless and can be a normal part of human sexuality. Relationship between mental health and sexuality. Mental health and sexuality are closely related, and mental health issues such as depression and anxiety can affect sexual function and emotional well-being. Screening tests. STD screening tests can be performed at health clinics, medical offices, and sexual health centers, and some STDs can also be diagnosed through home testing kits. Secondary premature ejaculation. Secondary premature ejaculation may develop as a result of physical or psychological factors, such as diabetes, hypertension, stress, or depression, and may require a different treatment approach. Sensual bath ritual. Many women enjoy a sensual bath ritual as part of foreplay, which may include bathing together with aromatic bath salts, candles, and relaxing music to create an intimate and soothing atmosphere. Sexual dysfunction. Sexual dysfunction can affect both men and women and includes problems such as erectile dysfunction, lack of sexual desire, and anorgasmia. Treatments and therapies are available to address these issues. Sexual education. Lack of adequate sexual education and societal pressure to achieve orgasm can contribute to the development of anorgasmia by creating unrealistic expectations and increasing anxiety during sexual encounters. Sexual pleasure. Sex is not just about reproduction, but also about pleasure and emotional connection. Pursuing sexual pleasure can be an important part of the human experience and contribute to emotional and physical well-being. Sexuality and gender identity. Sexuality is inherently linked to gender identity, but it is important to remember that gender identity does not determine a person's sexual orientation. People of all gender identities can have a wide variety of sexual orientations. Shockwave therapy for erectile dysfunction. Shockwave therapy is a non-invasive treatment that uses acoustic waves to improve blood flow to the penis, which may help improve erectile function in some men. Silent infections. Many STDs, such as chlamydia and gonorrhea, may not present obvious symptoms, leading to unnoticed spread and increased risk of long-term complications if left untreated. Smoking fetishism. Some people experience sexual arousal from watching someone smoke cigarettes, cigars, or pipes, or by engaging in smoking activities during sexual intercourse. Standing positions. Although less common, some women enjoy standing sexual positions, such as against the wall or leaning standing, which can add an element of adventure and risk to the sexual experience. STDs in animals. Although less common, some STD-like diseases occur in animals, such as chlamydia in koalas and canine venereal disease in dogs. Syphilis, a sexually transmitted disease caused by the bacterium Treponema pallidum, has experienced a resurgence in recent years in several countries, especially in urban populations and among men who have sex with men. Technological fetishism. With the advancement of technology, new fetishes related to electronic devices have emerged, such as attraction to sex robots or excitement over virtual reality. The health benefits of sexual activity. Consensual and pleasurable sexual activity can have numerous health benefits, including stress reduction, strengthening the immune system, and improving mood. The importance of self-exploration. Knowing and exploring one's own body is essential for a healthy sexuality. Self-exploration can help people understand their preferences, limits, and sexual desires. The influence of religion on sexuality. Religious teachings and cultural norms can have a significant impact on attitudes towards sexuality and its expression. Some religions have specific restrictions on sexual activity, while others promote sexuality as a sacred aspect of the human experience. The role of sexual communication. Open and honest communication about sexuality is fundamental for healthy and satisfying relationships. Talking about sexual desires, needs, limits, and concerns can strengthen emotional connection and promote intimacy. Themed festivals. Some festivals and cultural events include activities and performances related to the Kama Sutra, such as plays, dances, and art exhibitions celebrating its legacy. Human sexuality is a fascinating and diverse field that never ceases to amaze us. Sexual curiosities unveil the wonderful complexity of the human experience in the intimate realm. As we explore and understand these facts, it is crucial to remember that each individual is unique in their sexual experience. Respecting and communicating with your partner are the keys to a satisfying and healthy sexual life. Sexual education and understanding are essential tools for fully embracing our sexuality.